I'm so happy to introduce our next presentation, Rural Oral Health Dental Innovations. Here we have Jane Neubauer, Alex Orvik, Danielle Alida, Ebony, and Ebony Bollig, Tessa Maruska. Anybody I missed? Oh, Pam Lehman, of course. Oh, and Helen Tome. Look at this. So, yeah, we've added a few folks, but that's always a good thing, right? All right, take it away.
Hi, everyone. I'm Danielle Alida. I'm with Blue Cross Blue Shield of Minnesota. I'm a county liaison, and along with my colleagues, I do oversight. We all do oversight for the Regional Dental Innovations Coordinator project. So today we've brought all of them, so I was joking with them that it feels a little bit like they're winning Best Picture for the Oscars, because we're all up here. So I'm going to talk a little bit about the programs in its inception, and then they're going to share their work. So the Regional Dental Innovation Project started on a napkin. Our previous director, Beth Nelson, met with the public health office in Polk County, and they were talking about all of the things that they had seen on the community needs assessment and what public health does to try to keep their communities healthy. One of those things came up was dental, that the community was saying we need dental access, we need to find dentists. In greater Minnesota, we know that it is harder to find, that shortages across the nation are even worse in rural areas. So in that conversation, Beth and Sarah decided that it was really important that for public health that they recognize that they see it as an issue, but they have so many other things that they're working on that it's just one of those things that they don't always have someone to champion it. So on that napkin, they started writing about what it would look like to have a dental champion. And so from that came the Regional Dental Coordinator Project. What that would look like at a high level, I'm sorry, let me put this up here. What that would look like at a high level is trying to address not only positive health outcomes for Blue Plus members, but also for everybody within the community. We know that dental isn't just a one health plan issue, that it doesn't just happen in one part of the dental clinic. In greater Minnesota, we know that there are counties that have 0 dentists. And so it's impacting everybody. We also know that people are traveling sometimes more than 70 miles to get dental care. So that also negatively impacts dental areas where there might be a couple dentists, but if somebody has to come from another county, then they're utilizing their resources. So how do we get those resources as close to the community, just for the basics understanding of that we should have care in our communities, but at a grander idea of how do we share the resources and create resources. So their idea was to think local and act global. So what that meant was embedding dental champions within public health. And so for that, what they did was work together to say, we would fund the project to have a dental coordinator in regions that we identified. This all happened in 2019, so the conversation was that we would continue to do this, we'd see an increase in dental claims, and people would be getting dental care. Obviously, many things happened and that did not happen. So where we started with was just starting in Region 1 and then started adding dental coordinators over time. And what we really saw was that we needed to look at how they were doing the work. And one of the biggest pieces was that in 2023, when we were renewing funding, we saw that the claims weren't there, that people were not getting into dental chairs, and we thought it would go up, but in fact, in the areas where we did have dental coordinators, they went down. But we also saw that there were less providers in those areas. We knew that the pandemic impacted people retiring, people moving care elsewhere. So in order to do that, we decided that we were going to look again at how we were identifying success, because what we could see in our spaces and when we were working with all the dental coordinators was that they were making huge strides. They were creating community around dental. They were championing dental within their cities, within their counties, and within the state. And so we really looked at how we could look at it in a different way. So we started just identifying that so much of the work that they were doing was all of those steps that takes to get somebody to a dental chair before we even get a dental claim. So what I'm going to do is now introduce each of the dental coordinators by their region, and then they're going to share the work that they did to start getting these spaces available for dental within their region. All right, so first we have Alex. He is at Region 1. And I'll let you go.
Awesome. Thank you, Danielle. I'm Alex Orvik. I'm the dental coordinator for Region 1 in Northwest Minnesota. If you look on your table, there should be one of these there. That's just, you'll get a closer look at my map. It might be a little tough to see when it's up here. And I just wanted to start out by thanking Blue Cross Blue Shield for the funding that they provided us to do this amazing work. So with that being said, we've just got a few bullet points there on what I've done since coming into this position. I've coordinated and planned mobile dental clinics across 7 counties in Northwest Minnesota. Those mobile clinics are in partnership with Children's Dental Services, which has been phenomenal to work with in our area. And with that, we've been building and sustaining partnerships with local dental providers in Northwest Minnesota to see what the needs are, what they're seeing in their own dental offices when it comes to the population that has a hard time getting into the dentist. We've collaborated with the Minnesota School Sealant Program to bring their services into our local schools. We'll go on to the next page so I can show you some numbers there. Since 2023, the Minnesota School Sealant Program has served 402 children. It says across 13 schools. That's actually a typo. It's 15 schools in Northwest Minnesota. Actually, as of these past 2 weeks, I think, we're adding 2 more schools to that list. So that work is still going up. We'll go back to this. We've been working with Delta Dental of Minnesota, and we have 2 pilot projects currently going on in Northwest Minnesota. One of those is to bring mobile dental clinics to Kitson County, Roseau County, and Lake of the Woods counties, which is way up north. Danielle had mentioned there is a county in Minnesota that doesn't have a single dental provider. That is Kitson County. So we really want to get a mobile clinic in there, and with Delta Dental's help, we've been able to start pushing towards that. They've also given us a second pilot project, which involves handing out toothbrushes and toothpaste to daycare providers, as well as dental education. So that is going on in Polk County right now, and we're hoping to expand that to the rest of Northwest Minnesota when we can. But yeah, with that, I mentioned our mobile clinics. Those 2 bottom bubbles show our hygiene clinics and our restorative clinics. And those numbers are actually wrong now. Like, those have gone way up. This is since, I think, June. So since then, those numbers are actually wrong. But our hygiene clinics, we've seen 239 children, 63 adults. And our restorative, we've seen 145 kids and 18 adults. And then moving on, this is the map I was referencing. It is a little tough to see up here. That's why we handed these out. But since 2022, I took over in 2023, you can see it was pretty bare. We had 1 mobile dental clinic in Crookston, Minnesota. And when I took over, my plan was to add more access points throughout Northwest Minnesota. And that's where we have those 7 mobile clinics. You'll see those little yellow dots. Those are our school sealant programs across Northwest Minnesota. And then we've got little stars. That's going to showcase our safety net clinics. So one of those safety net clinics is actually in Grand Forks, North Dakota. We noticed a lot of our patients in Northwest Minnesota are crossing state lines to get access to care, especially dental care. There's a green star. That's going to be Northern Dental Access Center in Bemidji, Halstead, and Bagley. And they've been phenomenal to work with as well. They see a lot of our patients. I will say in the northern part of Northwest Minnesota, they're so used to travel that to come down to the metro for any specialty dental, it takes them about 5 to 6 hours from Warroad. And we just really want to highlight that these access points have really helped us see these patients before they need any of that specialty dental care. With that being said, that's what I've got. I think I will pass it on to Helen.
Hi everyone, I am Helen Tome and I am the regional coordinator for Region 3, but I am also the executive director for Ely Community Health Center. And if you don't know where Ely's at, it's about 2 hours north of Duluth, and our community center that we established there in 2015 started off as just a free medical clinic. So we offer free medical services once per week through the use of volunteers. We have volunteer doctors, volunteer nurses that come and donate their time for our medical clinic, and then we also have an affordable dental clinic. So we started out doing free dental care, but it did transition after getting set up to do some billing for medical assistance in Minnesota Care, that we can offer a sliding scale for those who are uninsured or maybe have private insurance that need to utilize our clinic. And then I'm also a MNsure navigator, so I can help a lot of our patients get set up with medical insurance, and that includes dental as well. So I do have some data here on the slide. You can see there has been quite a bit of growth. 2023, we did have 829 patient encounters, and that encompasses all of the programs that we provide. 452 of those were seeking dental services. And really, that is the primary reason people come to see us. And a lot of times they'll come in for dental care and then realize we offer these other services and can utilize those as well. And it did grow again in 2024, up to 865 patient encounters, and I expect to see more growth in 2025. These numbers are just through the end of June of this year. And I do want to highlight the development and the progression of our dental program. So we started out in 2020 with the funding from Blue Cross and Blue Shield, and we were just renting 2 small rooms from another organization to house both of our medical and our dental programs, and we had 1 volunteer hygienist at that time. And we have evolved into a full-blown medical and dental clinic with our very own facility that includes 2 medical rooms, 2 dental operatories, and I now have 4 dental hygienists on staff, as well as several licensed volunteers for our medical clinic. So we really work to increase access and remove barriers to care for our community and the surrounding areas. Ely is a pretty small community, and we do get several people that will travel to Ely from Duluth or from Hibbing or even Cook to come and utilize these services. So to see these kinds of numbers, I think our census right now, I think we have about 3,600 people that live in Ely. So, I mean, this is quite a big percentage of the people in our area that we are able to serve. And none of this would have been possible without the funding from Blue Cross and Blue Shield.
All right, well, good morning, everybody. It's great to see everybody. I'm Jane Neubauer, and I'm in Region 4, work with the Dental Innovations Project. And so I did a little overview here of the things that have transpired over history in our region. One of the biggest things that transpired back in 2010 was the opening of the Apple Tree Dental Clinic in Fergus Falls. And I see we have some of our Apple Tree folks here today. Good to see you guys. That was a huge thing. That was initiated really with the help of our public health office. Some of you may know her from years gone by. Diane Thorson was a huge, huge advocate for dental in our region. And so due to a lot of work from a lot of people, the Apple Tree Dental was opened there. They started to expand throughout the region in 2012 with their mobile operations. And so that was pretty exciting. That was a new and innovative thing that was really able to get care to people throughout the region. There was a little, things kind of stalled out, or rather just continued in their current capacity at that point. And in 2020, we were awarded the Blue Cross Blue Shield grant for the dental innovations. We took some time there. As we know, there was a pandemic that happened to hit about that same time. So during that time, we just did a lot of planning, a lot of community building, bringing folks together, discussing what the needs were. And between 2022 and 2024, we increased those mobile sites throughout our region to 24 different locations. So that was huge. We really started working with our schools, which is the one thing that I wanted to kind of focus on with our discussion today. So as part of the Partnership for Health Initiative and the statewide SHIP initiative, we were invited to participate in what were called school wellness committee meetings. And each school district has one, so if you're not familiar with that in your area, you should check into it. They all meet and they all have a work plan. And so in our region, due to the fact that I was able to attend those meetings, we added oral health to those school wellness meeting agendas. And so at every single school wellness meeting now we talk about oral health, we talk about education, what we can do to bring oral health into all the different aspects of school work plans. In many of our districts, we were also able to add wellness, oral health wellness to their policies, to their actual written school policy, that they would offer oral health education right alongside of mental health education, all those different things that are going on in the school, we added oral health to that as well. So that was pretty exciting. Currently in our region, we have 19 out of 21 school districts that are receiving some sort of a dental service in their school. So it might be an Apple Tree Dental Mobile Clinic, it might be Children's Dental Services Mobile Clinic, the Minnesota School Sealant Program, and we also work with another organization called Caring Hands Dental out of Alexandria. So that was huge. The other thing that we do as part of our education, and down on the bottom there we have, that's an annual number. We see about 5,000, a little better than 5,000 kids every year with dental education. They go out, we have hygienists, many different hygienists that we work with that go out to the schools and to help those kids learn about the importance of dental education. So this is just a quick overview of the Detroit Lakes or Becker County dental project that we have pursued with Apple Tree Dental. A pretty exciting thing that has transpired over years, again, with the investment and time of Apple Tree Dental, spending significant time helping them to get things up and going with a new dental clinic outreach site in Detroit Lakes. And then this is just a map that, as Alex had shared with you, this is a map just showing those dental access opportunities and how they've increased since the start of the Dental Innovations Project in 2020. So you can see the map on the right here, or the left rather, is 2020, and the access sites that were available at that time. And as you look over to 2025, you can see quite a few more dots on the map that have evolved since the start of this project back in 2020. And it's growing. As Alex said, this is a snapshot in time. We have since added 3 more facilities that are for the elderly that have just transpired. We'll be adding 1 more new school district this fall and 1 more next spring that we've already coordinated care for. So that's just a little overview of some of the things that I've done in my district. And again, in thanks big part to the Blue Cross Blue Shield of Minnesota Dental Innovations work. So I'll hand it off to Ebony.
I'm Ebony Bollig. I'm the Regional Dental Coordinator for Region 5. So everybody, has kind of touched on in schools or mobile clinics. So I just kind of wanted to switch it up a little bit and share something that I worked pretty hard on. So I'm going to condense a 2-year program into like 4 minutes. So bear with me. So I started the project in August of 23. Our nurse in our jail just had mentioned there were a lot of inmates that would be coming in, and when they did their health assessment, they had severe dental problems. And basically what happens within, especially our county jail, is they kind of get put into a separate group. So if you do not have a dental emergency per se, you're basically just going to get an antibiotic and they're just going to let you be. Most times inmates are released, within like a couple weeks to maybe a month. So they, like I said, just kind of will give off an antibiotic just to make them comfortable, and then they're released. So after my second bullet point, many failed attempts. I had so much where I really didn't realize how complex it would be to have a dentist come into our jail. I was thinking, we're just going to find a dentist and find some assistants, and they're going to come in, and we're going to just get everybody seen. Well, I found out that was not the case at all. So then again, our goals were to save money by not sending out inmates. That was a huge thing because sending out an inmate, which I'll kind of touch on later, there's a lot of moving steps to it. Another thing I didn't think would be an issue. But I did spend lots of time too inquiring with other counties. So within my region, Cass and Crow Wing had a dentist that came into their jail. So I talked with them a lot about insurance and policies, and like I said, all the, again, moving parts that, I wasn't quite sure about. So just to kind of touch on things, I first started with a dentist. Again, it fell through. So then I finally, stumbled upon somebody that I knew, and she's like, hey, Apple Tree in Little Falls. They had just opened their clinic not too long ago. They were working on staffing, so they just had, a couple loose ends to tie up with that. So finally I was able to reach out to them once they had all of their staff in, and she had said, hey, let's maybe just reach out and see what happens. And again, after many Zoom things with everybody, I finally was able to secure some things with Apple Tree. So I'll just kind of share some stats. This would be before Apple Tree came in. So inmates being sent out was huge, and then also inmates needing antibiotics and inmates who needed care but it wasn't an emergency. Again, they just kind of put that into their own group, and if you don't need care, then we're not going to send you. But if it's progressing and it's worse, we'll send you out. And then this second one here is after Apple Tree has came in. So the number of inmates being seen by Apple Tree, it's been insane and it's crazy. I think our jail is max capacity of 58 inmates, and to date we have seen almost 25 to 28 inmates. As you can see, the number of inmates being sent out is now 0. We have not had to send any inmates out since Apple Tree has been in. And antibiotics has went down as well. When I was speaking to the nurse, she just told me that number is mainly from weekends or holidays, things like that, to where if the dentist or if Apple Tree is coming on Monday, we're just gonna hold them over and use an antibiotic until then. So this is just a little thing about just cost of everything. This was again before Apple Tree. So getting to pay somebody just to do transportation, $300, that's on the very low end. And that is just for one deputy. So now let's say we have a higher risk inmate and we need to have, let's just say 3 inmates. Well, you can do the math. That adds up to a lot just for transportation. Then let's just say, again, on the low side, we all know for some things, dental care can be over thousands of dollars. I'll just put $1,000 for reference. So then that is something that we as the county are paying for up front, versus when Apple Tree comes in, we're able to see if the inmate has insurance, then we can bill to that insurance versus us having to pay for it. And then a cost of a prescription, they may need amoxicillin or clindamycin or maybe something to hold them over for pain. So again, that's another thing we're adding. So this whole program, like I said, and huge thanks to Apple Tree, I could have not done it without them at all. But like I said, mainly we just wanted to do this to help save, a lot of dollars and be able to help people in need. So I will go ahead and pass it over to Tessa.
Hi everyone, my name is Tessa. I'm the dental coordinator for Region 7W, which is Benton, Sherburne, Stearns, and Wright County. And I will say I am the newest of the coordinator group, starting in this position just 6 months ago. But I will highlight there were 2 previous dental coordinators before me, both working in Wright County. So this map that you see on the left side, I want to give them the credit for most of this work. And something I just want to highlight on the map is these are access points for those who are uninsured or underinsured. So you'll see we have 2 nonprofit dental clinics, one located in Wright County, which is Community Dental Care. And then the other one has not opened yet, but it is in Stearns County, and it is Bright Smiles. They're opening in about 3 weeks. So looking forward to that as well. But something you may be able to see is Benton County, we have no access points for our residents or others who maybe work in the county who are looking for dental care. So what I am working on is establishing 2 mobile clinics to come out to Benton County at 2 different locations to help increase access to dental care. And then also I'm still working on making connections within like schools, as others had mentioned, and then promoting what they can do, how they can implement mobile clinics, how they can implement the school sealant program, since we know that kids spend much of their time at school. If we can get them care while they're at school, it decreases barriers like transportation or parents having to take off work to get their children seen at the dentist. So the other thing I want to highlight is just starting 6 months ago, something I have done is go out into the community and attend these outreach events, which may be health fairs or just other community events that are happening around the region. At these events, I provide education, so the importance of seeing the dentist, of brushing your teeth, different things like that, just to encourage people to see the dentist, to brush their teeth. But then also I give resources of here are the dental clinics, here are the mobile clinic locations, so they know where to get care. Because if they don't know where to get care, they're not going to get care. And then I also provide toothbrushes, toothpaste to encourage people to brush their teeth, but then also give them the opportunity. I've had kids tell me, well, I don't have a toothbrush, so how do I brush my teeth? Which is really impactful for me. So I try to provide those materials so that kids can learn to brush their teeth and they can brush their teeth. And then the other thing is we know that oral health and overall health are connected. So sharing resources such as if you qualify for WIC, how do you enroll in WIC? How do you get those resources to have access to nutritious food? And just break down those other barriers such as transportation. If you don't have transportation to an appointment, what are your options? How can you get that transportation? Because we know that every community has unique needs. So I get to be that person out in the community that gets to listen to those needs, advocate for those needs, and then bring that up to our county commissioners, to other healthcare professionals, and just bring the awareness to the shortage of dental access in our region. I will pass it to Pam.
Good morning, everybody. I'm Pam Lehman, and I represent Region 8, which is in southwest Minnesota, and probably being, one of the very least populated areas of the state, and we are definitely a dental desert. It's been a great privilege to work with all these dental champions. I love that. That's Danielle's term. And it's a great opportunity for all of us to figure out what are the needs in our region and then create something that we can be passionate about and something that we can do to help in the oral health realm. So I serve 9 counties, and we have always tried to do a lot of the same things that all the others do, but one of my passions is access to care and recruitment. There we go. And probably, there's a couple of projects that I'm going to highlight, but I'm probably preaching to the choir here a little bit, but there's just a lack of dentists available to even care for patients. And a little over 2 years ago, we were able to find out about a new dental program that was started at KCU, and they were looking for locations in the Midwest, where these students, once they got to their final year of training, could come and do 12-week rotations. These students will come to the locations in pairs and work on patients and try to find out what area of the country they're interested in working in and hone their skills while they're there. Now, as a recruiter, I'm looking at this thinking if we can get these folks into our dental clinics, get them into our small rural communities or into our underserved areas of the metro, maybe they can find somewhere that they can be passionate about coming back to and hopefully making a permanent home, either starting their own practice or possibly even working for someone that's there. KCU, Kansas City University. Yeah, I believe it's down in Missouri. You can kind of see it on the map here, but it's a little bit difficult, sorry. So anyway, we made some connections then with the university and then turned around and reached out to lots of organizations within the entire state of Minnesota. And we're really excited because there's going to be 4 locations in Minnesota next summer in June of 2026 that are going to host these students and bring them here. We were talking about this yesterday. Maybe they'll meet the love of their life and when they're here and they're training, or maybe they find a passion for fishing that they didn't know. But whatever it is, we want them to come here, right? And we want them to make a home here and provide dental care. So that was kind of the goal of this. The map here, and you guys can have access to our slides, I know, after. But there were lots of connections throughout the Midwest, and if there are any facilities that are interested in the future of hosting some of these rotations, you know, we can definitely be a part of that process and help you with that. The other thing when we think about access to care, and one of the things that I think is really important about this Dental Innovations program that Blue Cross and Blue Shield implemented, is that it really shows that nothing happens overnight and how long things take. So whether it's bringing these KCU students here or starting a new clinic. When I first came into this role, we applied for some funding through Prime West as a group down in Nobles County, which is right along the Iowa border. And we were awarded funding to open a brand new clinic, help, you know, fund the salaries for a dentist and the staff and all of those things. But finding someone willing to step in and take over that role was a lot more difficult than any of us could ever have anticipated. You know, as a county entity, Nobles doesn't have the capacity to own and operate a dental clinic, so we were trying to find some partners. And we actually went through 3 different partners before finding our 4th and final partner, and it took 2.5 years, and before it opens, it'll be closer to 3 years before it actually, you know, becomes a viable clinic to help people. So it's a great collaboration between county, public health, private industry. Avera is a major healthcare system in South Dakota and Southwest Minnesota. They actually had a space in Worthington that was built for dental care, but they did not have anyone using and accessing the space. They have given us full access to it. They're going to allow us to renovate it and then take over that space and use it. And so we're planning to start with 1 or 2 days a week of service with a goal to be up to 5. So that's it. I'm going to hand it back to Jane, I guess.
So that's just kind of a summary for you all of the different dental innovations activities that have taken place across the state of Minnesota. This is a map I wanted to share with you from one of our partners, Children's Dental Services. And it really does a nice job of showing the growth and the progress that has transpired with dental access just through one of our providers in the state. So as you can see the map over here, there was lots of white spots where there were no services. As you look over to 2025, nearly all of our counties in Minnesota and all of our counties that are represented here with the dental innovations work now have some sort of a dental provider providing care there in their region. So just another little map and showing some of the outcomes. This is really kind of a summary of what we wanted to talk about today. This really is a collaboration and a community-driven effort. We all work with many different partners, and we all, you know, we need those partners. We all need to work together. It really is a local needs. It's driven by local needs. Each community does something a little bit differently based on what their respective needs are. We learn from each other. So we meet every 2 weeks. We have a meeting with this group of people. Pam tells us about her activities with Kansas City University, and we're like, wow, that is so cool. Ebony is doing things at the jail, right? I mean, they're vastly different things, and they're things that are needed respectively, but we learn from each other. We've had just some huge progress with the medical dental integration. A lot of that is in thanks with partnership to Nancy and the Minnesota Oral Health Coalition. We're all just so busy doing that. And more again, just to Blue Cross Blue Shield providing this funding, it really has built a firm foundation for all of us to build on and all of us to grow. We've generated millions of dollars outside of Blue Cross Blue Shield as a result of this project. You know, we were visiting last night and Helen said, well, I had 50 grand from this organization, and this organization over here just put another 10 grand in our account because she's in Ely. There aren't a lot of these types of services and programs, and they're very unique. And so people are wanting to fund those types of activities. And again, what it comes down to is that there's improved access to health care for members, for all of us, right, across the state. and huge cost savings for folks that don't have to travel many, many miles to get the care that they need. Pam mentioned the fact that it's true, systems change, it takes time, all of this takes time, but those long-term investments really do pay off. So here's just a few ideas. What can we do in our region, or what can we do in our area if we do not have a dental innovations person specifically? Just a few thoughts that our group came up with, but be that voice of dental. It was comical last night, we were visiting, and Tessa said, you know, what about dental? At every meeting that she's at, what about dental? There's an empty building, maybe we should put dental in there. You know, just keep talking about it. Talk about it with your peers, talk about it with your neighbors, talk about it with your friends. Educating those local legislators, a simple email can go a long way. It doesn't take a lot of time, but we have to keep bugging them. We have to keep reminding them of the needs that are out there when it comes to dental. Workforce development, a little comical story we have about grow your own dental professionals. It's something we work on in West Central Minnesota with one of our early childhood groups. We started talking about, at what age do you start talking to kids about dental professions, right? 8th grade, 9th grade, 10th grade? No, it's much younger. So I have a granddaughter, and she probably hates it that I tell this story because she's a teenager now, but when she was quite young, I said, what would you like to be when you grow up, Chloe? Have you ever thought of being a dentist? And she said, she was 9, and she said, no, Grandma, I'm going to be a pharmacist. And I said, what? You know, so anyway, I am very pleased to tell you that she is now 14. She has her dental school picked out where she's going to go to dental school. So, you know, you have to talk to them. That little kit down in the corner there, we are distributing those, many of them. We've ordered many of them throughout our region, and we distribute them in early childhood programs. So those little kids have that dramatic play experience of being a dentist. They're really cool. You see that little drill over there? It has a string on it, and you pull it, and it goes bzzz. And so you can simulate drilling those teeth. Family resource centers, it's a big buzzword. Everybody's doing it, right? They're being developed all over the state of Minnesota. They have lots of different health components in them. Do they have dental in your community? Have they talked about it? Be that representative there. And then again, just to connect the dots between those mobile providers and our schools. Our schools are a key player in all of this. That's where our kids are. They're being seen there. We need to advocate for our dental providers in the schools. Just something that we can all do there. So that's really what we have for you today. One thing we wanted to do, if we have time, Nancy, do we have just a couple minutes? We wanted to kind of hear a little bit from you. So what is happening with oral health in your communities? And so we're going to... Oh, yep, and we can do that too. We can answer questions. At what time, how much time do we have yet?
Let's do, I just want to give everybody time to ask questions.
Sure.
Do you want to do questions first?
Should we do questions? Okay, go ahead. And does anyone have questions for any of our members? And if all of you just want to stand out here and show your faces, we thought that little hideout back there was great. So, yes, Dr. Crespo. Okay, yes. We will repeat the question. She is asking about the Kansas City State University program that Pam's been working on and whether or not the Minnesota School of Dentistry or U of M is familiar. So I'm going to refer to Pam.
I am not aware that they are familiar with it or not, but our contact information is all going to be available, and anybody that wants to get connected and start a conversation with KCU, I'm happy to connect you with them.
Okay, awesome. Yes.
First of all, I want to thank you all for your compassion around all these topics. When you look at that map and think how important that is. I wanted to ask specifically, Ebony, I think it is, about whether our major metropolitan counties have either A, led the way in doing what you're doing, or B, called you and said, hey, we should do this too.
And you talked to Ebony, right? Okay. Do you want to repeat the question?
So basically, the question was asking if jails in the metro have reached out to me, or if anybody kind of paved the way. Is that yeah? So no, nobody really reached out to me. It really was just kind of our nurse in Morrison County who had reached out to me. And as far as anything paving the way, there, and Tessa and I were kind of talking about this too. There is the prison in St. Cloud, and when I was in dental assisting school, they had came in and they wanted to recruit people, to work in the jail and to be assistants, things like that. So immediately, kind of when I got this program going, I kind of thought more of them because they had a dentist, they had an assistant, I believe they had a hygienist as well. They had, chairs, equipment, everything, and that's kind of where I, started to snowball with everything as to where are we going to get all of this from? Because one, as the county, we can't afford to do all of that or have a room. So again, that's when Apple Tree had all of their mobile equipment that they were able to do. But yeah, I don't know. I hope that kind of answers your question. I mean, I don't know if you anything else.
As a large audience here, hello, Hennepin and Ramsey County,
Yeah.
let's step up to this, right? Very good idea. Thank you.
And to speak to that a little bit further, I think that's what's so impressive about this group is that because they're regional, they're sharing information, they're sharing ideas. So the KCU came from a partner who's not up here, but the Lake Superior FQHC that also works with us. And so they're sharing information, but they're also working with all of you, as many of, Apple Tree, Community Dental, Children's Dental, all of these, and many of you that are all here, they're partners and they're stakeholders. And so they're taking those questions like you have, has Hennepin County learned? And then bringing that back in and trying to get those connections. They're gonna keep working. That's what is very evident, and I think this is just a really small snapshot of what they've been doing for the last 5 years. But they're gonna keep working. They're gonna chase down those leads. They're gonna make those connections. And that is really, I think, the beauty of what they've done. The hard part is, right, it's grant funded. The other hard part is that it's one person, but that one person can continue to make that difference in their community, and it ultimately can make a huge difference in the state. So I think it's those stakeholder groups that they're all connected to within their community, and then together they talk about those and try to make those connections. So they're open to that. Go ahead, Priscilla.
I just wanted to share that we've been using your model to be part of the legislative proposal a few times, and Enrico knows about it. We have also included the same model in our rural health transformation project. So every time we're writing a legislative proposal, this is always there, but we need everyone to educate our policymakers and also talk to our MDH leaders and tell them the stories that we shared here. But at least we're doing all we can at the state level because you are embedded into the local public health system, and Blue Cross Blue Shield is really nice to enable you to work with all the community members, right? It's not just related to one entity, which is the beauty of the project, that it's so collaborative. So just wanted to share that there is some hope out there that this could be beyond just the grant funding, but something that state might embrace at one time. But we're not there yet, but we need support to educate all those who are involved in decision making.
And that's what's been so exciting about it, and I think that's what the time has taken. So as we were talking last night with a leader from Blue Cross Blue Shield, there's so many things that they can share, so many stories that really get down to the actual person getting the care, that at the end of the day, this is about a kid who's in pain. It's about somebody who has to travel to the metro, and they were told that first they needed to wait 11 months before they were going to get their teeth removed. And so driving 300 miles one way just to get care, those are the stories that keep all the people up here moving. Those are the stories they're hearing every day. And so it's really making that difference and trying to share and say, like, this is a model that works. If we're duplicating something, let's learn about it and let's try to take what you've learned, take what we've learned, and move forward. Let's replicate these. We've got templates that they can use for staffing models, for bringing on new providers, for people who want to do volunteer work, but also want to do something connected within their community. So that to me is the really exciting work that they've done, and I encourage all of you during lunch to just ask them about some of the work in their region, and what they're doing, because it makes such a difference.
Let's give everybody a round of applause.